A 1940 brainwave machine featuring 4 flexible metal rods attached to the skull was used to measure electrical activity in the brain. At the time, this was cutting-edge science, and also unsettling to look at. A portable iron lung from 1955, designed to allow polio patients to recover at home rather than remain in hospitals. These respirators mechanically helped patients breathe by regulating pressure around the chest. In 1960, Dr. G.H. Byford stood inside an optokinetic drum while wearing a contact lens with a miniature lamp cemented to it. This device was part of a study at the RAF Institute of Aviation Medicine, used to investigate how eye movements relate to illusions and pilot disorientation. This wire mesh suit from 1960 was designed to monitor body temperature during high-speed and space travel research. It measured how the human body reacted under extreme physical stress. A rotating cobalt machine, used in 1955, swung around the patient's body to deliver targeted radiation therapy for cancerous tumors. It was one of the earliest forms of focused cancer treatment. At the Francis Delafield Hospital in New York City, a physician adjusts the massive beam path of a 2 million volt deep therapy X-ray machine used for aggressive cancer treatment in the mid-20th century. Large motorized eye models were developed by aeromedical researchers to study eye movement and visual perception. The models were controlled by small motors and used for training and diagnostics. Winston Churchill's personal pressure chamber, built in 1947, allowed him to safely travel at high altitudes during his wartime flights. It maintained cabin pressure and oxygen levels. 3 humanoid shells filled with sodium chloride solution were used to simulate human tissue in experiments measuring radiation exposure, part of early nuclear testing protocols. The Begonic chair, used during World War I, delivered electrical stimulation to patients diagnosed with psychological disorders. It was believed to relieve symptoms of shell shock, today recognized as PTSD. In 1957, children were placed on the Röntgen steed, a horse-shaped restraint device that kept them still for chest X-rays. The playful design was meant to ease fear, even though the procedure remained invasive. An elderly man sits in a bulky, motor-powered device designed to stimulate blood circulation in the legs. These machines were commonly used in the 1950s to treat vascular issues and immobility. Inside the Light Care Institute in the early 1900s, women bathed in electric light baths, which combined heat and light as a supposed cure for conditions ranging from arthritis to fatigue. Iron lungs, like the Drinker and Emerson respirators, used air pressure to help polio patients breathe. They were powered by electric motors connected to a pumping diaphragm. These machines were life-saving, but isolating. In 1922, psychiatric patients at a New York State asylum participated in dance therapy. At the time, movement was believed to release emotional tension and reduce agitation. Dr. Clark's spinal apparatus, developed in 1878, was a rigid frame designed to correct spinal curvature. Though visually intimidating, it was one of the first mechanical attempts to treat scoliosis. A radiologist operates an X-ray machine at Westminster's Central Hall in 1934, wearing protective gear no longer deemed necessary today due to improvements in equipment shielding and safety protocols. In 1938, Dutch asylums used a lunatic's chair, a large, padded restraint chair, to calm patients considered dangerous or disruptive. It was part punishment, part outdated psychiatric treatment. A solitary man stands restrained in a straitjacket, one of the most common methods for controlling mental health patients well into the mid-20th century. Lateral cerebral diathermia treatment, used in the 1920s, sent electric currents through the brain in hopes of curing psychosis. Ultimately, it proved too dangerous and unpredictable to be continued. Lateral cerebral diathermia treatment, used in the 1920s, sent electric currents through the brain in hopes of curing psychosis. Ultimately, it proved too dangerous and unpredictable to be continued. At Cochin Hospital in Paris, circa 1914, Dr. Maxime Menard performs a chest X-ray. He later lost a finger to radiation exposure, a risk many early radiologists faced before proper shielding existed. In Vienna, patients were transported in horse-drawn ambulances fitted with layers of stretchers. Curtains offered minimal privacy. The Viennese Voluntary Rescue Society, founded in 1881, operated these carriages. Dr. Elizabeth Broyne sits inside her horse-drawn ambulance, circa 1911. She was one of the few female physicians practicing emergency medicine at the time. Hospital trains in 1900 were equipped with surgical and examination rooms, offering mobile care for wounded soldiers and remote populations. In July 1939, a woman in labor inhales analgesic gas while a nurse monitors her. These early pain relief methods were rudimentary, but a step toward more humane childbirth. A newborn receives oxygen treatment in Berlin, 1939, part of a growing understanding of infant respiratory distress and early efforts to reduce mortality. A patient lies in an iron lung around 1938, its rhythmic vacuum creating the rise and fall of breath. Many spent weeks, months, or years in these devices. Nurses in 1938 train on a respiratory jacket, a wearable device that mimicked the function of an iron lung by compressing and decompressing the chest. Gerald Blackburn, a young boy, rests in an oxygen tent at Princess Beatrice Hospital in 1937. These tents delivered concentrated oxygen to ease breathing. A woman uses an electric inhaling machine in 1929 to breathe in medicated vapor, a common treatment for colds and flu. In the 1930s, Germany, patients inhale menthol and eucalyptus powders at a hospital to treat respiratory diseases. Inhalation therapy was an early form of pulmonary care. A woman wearing a flu mask in 1919, one of millions worldwide trying to stop the spread of the deadly Spanish flu pandemic. The R. Dubois anesthetizing machine, circa 1913, delivered ether to patients. It marked an early step toward controlled anesthesia during surgeries. Lieutenant Ratke uses a mercury column to regulate air pressure during breathing tests. His doctor checks his blood pressure, part of 1930s high-altitude training. A man sits beneath a sunray lamp in the 1930s. These UV lamps were thought to treat everything from depression to tuberculosis. A new hip massage machine from 1928 promised to reduce hip pain and improve circulation, part of a wave of electric therapy devices sold for home use. In 1931, Post Office Inspector D.F. Angier and Dr. L.F. Kebler try a device that claimed it could stretch the body and increase height by several inches. A young woman sits with her arms and legs immersed in 4 electric water baths a treatment meant to boost circulation circa 1938. Women operate a mechanical stretching machine used to prepare surgical dressings at the Red Cross headquarters in Cincinnati around 1915. A Röntgen look-through machine from 1929 in Frankfurt allowed X-ray visualization with reduced risk to the physician thanks to its shielding design. During a plague outbreak in Manchuria around 1912, this doctor wears early protective clothing, including goggles and layers of fabric designed to block contamination. Dr. Louis Sayer observes spinal correction as a patient suspends herself before being wrapped in a plaster cast, a method used from 1850 through 1900 to treat scoliosis. Before the polio vaccine, some children were confined to iron lungs for months. These machines were their only chance at survival, but many didn't make it out. In the early 1900s, people hid deformities using crude, mask-like coverings, often made of leather or papier-mâché. The result was eerie, but necessary in a time with few alternatives. Doctors treating plague patients wore masks with long beaks, filled with herbs like lavender or mint to purify the air. The masks were primitive respirators and iconic. In a Chicago orphanage in the 1920s, nurses tan infants using UV lamps to prevent rickets, a bone disease caused by vitamin D deficiency during long, sunless winters. A radiology nurse technician stands beside a mobile X-ray unit during World War I in France, 1918. These machines helped diagnose fractures on the battlefield. One of the first surgeries performed with ether took place in the 1840s. By the Civil War, both ether and chloroform were used, with chloroform gaining favor due to its faster effect and non-flammable nature. Artificial legs in the early 1900s were heavy, mechanical, and often handmade from wood and metal. They offered mobility, but very little comfort. If you felt something today, curiosity, nostalgia, maybe even a tear, hit that subscribe button. We'll keep exploring the rarest corners of history together. Thanks for watching. I'll see you in the next one.